Now, the biggest tip that I can give you this week to help you, okay, become that go-to physio is to address objections in the first session. So in that first session, the main thing that the patient wants is what's the problem, okay? What do they need to do to solve the problem, and how long is it going to take? They're the three big things. Now, what's the problem, okay, is not what's the diagnosis, okay? What is the problem that's causing the symptoms? There's a big difference to that, and we're going to talk about that in its own segment in an upcoming episode. So what's the problem? What do I have to do to solve the problem? Okay, and how long it's going to take. Now, it's worth mentioning how long it's going to take, okay, in that first session. Now, the reason that is because you'd want to ultimately address this big objection in the first session. So if you are of the understanding that this person's had, this pain for 10, 12 years, it's probably going to take 6 to 10 sessions minimum, okay? Based on the story, the adaptations, the amount of work you're going to have to do. This person may have been led to believe through a friend, again, if you're getting a lot of word of mouth referrals at this stage, as your confidence and clarity in your ability to deal with any patient that comes through the door increases, you get this word of mouth reputation coming, okay? This person may have had a word of mouth referral from someone else. Go see yourself. They sorted my knee pain out in 2-3 sessions, okay? But there's a big difference between having, obviously, yourself, an acute knee pain versus somebody who's had this pain for quite a while, and we have to undo a lot of these movement habits. So addressing the expectations in that first session is very powerful, because this is, again, remember, build a stress-free business, okay? And you getting stress-free down the line is ultimately going to be dictated by that first session, because if you can address those objections, then you're not going to have that stressful, awkward situation in session 4 or 5 when you think the patient is making good progress. They're getting a bit agitated. They were expected to be out of pain at this point. They've paid you 200 quid, and they were expecting that they would have felt a little bit differently now. Whereas in that first session, if you've addressed this objection, okay, the first thing that's going to happen is they're going to get emotional, and then they'll start to logically see why maybe their old belief, okay, was maybe a little bit unrealistic. Okay, so this will save you a lot of time, a lot of stress in building your go-to physio practice coming down the road. Okay, so address that first. Address the big objections in the first session. It'll save yourself time, and I'd rather do that in the first session so everybody knows where they stand. So all that's left then in the subsequent sessions is getting the most, getting that ideal outcome for that patient, so that we can make meaningful impacts on their lives. And remember, the therapist, you as a therapist, you're the guide. You're not the hero in the story. Our job is to guide that patient, allow them be the hero in achieving their ideal outcome. Okay, you tell them how long it's going to take, but you also have to justify that as well. Okay, you having your structure, you having that step-by-step return to higher activity system or return to play system, whatever you call it, that's the thing that gives you the confidence and the clarity to justify why it's going to take as long as it's going to take. Okay, so most people will not mind once they can logically figure that out, once you can justify it, okay, and once, most importantly, it makes sense. Okay, so as always, address the big objection in the first session, and I think you might start to find you've got a lot less stress in the subsequent sessions.